I remember really vividly getting the phone call, "You have testicular cancer."
Yo no imaginaba que me iba a tocar tan joven.
I walked out of the hospital and realized, well, now what?
What's my quality of life going to be?
Patient-centered care is all-encompassing. It's before treatment, it's during treatment, it's after treatment.
Because the doctors have got so many other things on their plate and so do the nurses, they often don't see the fallout. The anguish that the person's going through, the family's going through, they're more than just a face. They're more than just a scar. They're more than just an organ that was removed. They're more than just whatever's on that chart.
Individuals who have cancer see multiple healthcare teams. They go from place to place to place, and that care is often fragmented. And so in order to deliver better outcomes, we need to deliver patient-centered cancer care. Patient-centered care is respectful of and responsive to the needs and values and preferences of individuals who are facing cancer, so that the individual is at the forefront or the center of every clinical decision.
It has to be a two-way street where the wishes and the thoughts of both parties are respected and listened to.
I tell patients that I'm here as your consultant and your advisor, and I can make recommendations, but the decisions are up to you.
I had really good doctors that would walk me through everything and take their time and spend a lot of time going into detail about everything, and then some who wouldn't.
Everybody wants care to be more patient-centered, but our structures are just not set up to do that.
I truly believe that people who work in the field of oncology want to deliver patient-centered care, but there are many obstacles that can make it a challenge. Some of that has to do with payment reform. Some of that has to do with insurance. Some of that has to do with having the right electronic health information exchange options.
Right now, every time a patient goes to a new provider, they have to rehash the whole entire story of their care. Every time it's retold, details are lost. It adds so much additional stress to what's already such a challenging situation.
There are so many incredible physicians in the oncology community who want to see a new model of patient-centered cancer care. And so this is not an us versus them. Whether you're the patient, whether you're the caregiver, whether you're the physician, whether you're the social worker, the nurse, a new model should improve the outcomes for all of us.
What I would hope to see over the next 5 to 10 years is that we shift the curve so that much more of the care is delivered in an ideally patient-centered manner.
At the end of the day, the doctors are there to do their job, but I'm here to stay alive, and they've got to see me for a couple of hours here and there. And I'm sitting there trying to figure out about who's gonna mow the lawn, who's gonna keep going to my job, and so it's a lot more than just dealing with the medical problems in my book.
I think if you're with somebody who's leading your care that can understand that you're feeling sad or whatever it is, it's gonna help you get through it. You know, you don't feel like this thing that they're treating, you feel like a person.